Moonword talk, 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 Moonword talk. Yeah, we be the truth. Be that.
Thank you guys for everything you guys have been doing. I remember the day that we have just 200 subscribers on our YouTube, but now we are close to 600 subscribers. That is progress, and I just want to tell you all that I'm going to appreciate it if you all can just continue supporting the brand. And if you guys can keep on supporting the brand, me and my team, we are going to try our best to give you the best podcast in Nigeria. Thank you guys. Welcome back to another episode of Moonword Podcast, the podcast that brings you motivation, inspiration, and real life strategy to help you level up on a daily life activity. And today we are going to be diving deep into the health sector about your dental issues. Today, I have an amazing guest in the studio, and we are here to uncover some hidden truths you guys don't really know. You understand? We brush, we rinse, we move on. But what if I told you that what is happening in your mouth right now might be silently damaging your heart, your brain, and even your future children? I have a guest in the studio. He has first-hand experience in everything related to dental issues. Let's welcome him to the show. Let's welcome Dr. Farouk to the show.
Thank you so much for having me today. Yeah.
It's a pleasure having you in the studio, Dr. Farouk.
Yeah, same here.
Dr. Farouk,
Yeah.
before we get into science, most people know what you do, you understand?
Yeah.
But I want to ask, who are you? Who are you really? Who are you?
All right. So that question is actually very, I don't know. It's kind of. But then, so who am I? I'm Dr. Farouk. I'm a dentist and an oral health influencer. So that's who Dr. Farouk is.
Okay. What shaped your journey and made you care so deeply about oral health? What's really inspired you?
So for me as a dentist, that's from being a dentist. When I was in school, I did my final year, I had a project, and my project was on oral health literacy amongst adults in a particular area, and oral health utilization. So that basically just made me understand that, so many people actually don't even pay attention to their oral health, and they've never even seen a dentist or even know anything that relates to their oral health. And one thing about me is that I like it when people smile, and I've noticed that if your oral health is bad, definitely you won't be able to smile. You'll be having toothache and you smile. You're not going to be smiling. You're going to be shouting. So that's basically what inspires me to start what I'm doing.
That's amazing. That's amazing. Dr. Farouk, what are the small everyday signs that people dismiss but could be early warning sign of serious diseases?
Okay, so when it comes to oral health, there are certain signs that so many people actually see, but one way or the other, they just try to overlook it because they're like, I'm not having pain, so for that reason, I should not see a dentist or I should not seek a dental care. One of the signs is bleeding gum. So many people, I'm very sure you're watching this video and you actually have bleeding gum. There are times that you brush your teeth and you see blood. And in your mind, you're like, well, I'm good. You're not really good, though. Just have that at the back of your mind. That's one sign. Then another sign is sensitivity. So let's say you take something cold or probably air enters your mouth. You don't notice that you don't have this sharp pain. It just comes and goes. That's another sign. Then another sign, which is very common, is bad breath. When you say that, you have bad breath, then you need to see a dentist. There's something going on somewhere. It can be a gum disease. It can be that you have tooth decay. It can be anything whatsoever. So those are the signs, early signs of dental issue that you see that, yes, you need to see a dentist. But as much as all those signs are there already, we usually advise that you see a dentist at least every 6 months. So don't wait until when you have those signs. See a dentist.
At least every 6 months.
At least every 6 months.
How can a minor untreated cavity silently impact person heart or immunity?
Okay, so all those things can actually impact your immunity in the sense that, so the way, let me start with tooth decay. The way tooth decay actually works is that it starts with an hole in your teeth, and that hole starts going deeper. The teeth is made up of 3 layers. We have the enamel. The enamel is what we can see. That white when you shine your teeth, that's the enamel.
Really?
Yeah, exactly. The second layer is the dentin. That's the second layer, and it's very, very sensitive, very sensitive structure. While the third layer is the pulp, where we have the blood supply, the nerves, and all those things, every other thing. That's that. But if you have a tooth decay, let's say you have an hole in your teeth, the hole starts from the enamel, the first layer. And usually they start very, very tiny. So these things keep on going deeper and deeper. And next thing, he gets to the dentin, which is the second layer, which I just mentioned. And when he gets to the dentin, you start having sensitivity, sharp pain. At that point, you've not really had toothache. You've not actually had the toothache. But as soon as it gets to your pulp, that's the third layer. That's when you start having the actual toothache. And what people don't even know is that, let's say this there's someone that has already a medical condition, can be anything whatsoever. And there are times that you might not even have a medical condition, and that tooth decay that you're having, or that toothache you're having, can actually lead to a life-threatening condition whereby you have to go for an emergency surgery. So many people don't know that people actually lose their lives from just a tiny tooth decay that just starts very small. So many people don't know. You can actually a lot of things have happened. We have lost patients. We've seen patients that due to one tooth decay or the other, they lost their life. And it's not just about tooth decay. There are times that it has to do with gum diseases. We're having bleeding gums. That is always very common. So people even have post-discharge. That's another level. It's getting deeper and deeper. When you start having post-discharge, then you need to see a dentist. Don't wait until when it's something really severe that leads to a serious swelling and you can't breathe anymore. And you need to then at that point it's an emergency. You don't be seeing siren everywhere, pom, 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 and stuff like that. So that's just it.
That's amazing. There's this person I know about. You understand?
Okay.
Anytime he used to talk to me, I used to pass it. This person has a bad breath, you know. Me, I did not say anything. You understand? Maybe it might sound maybe rude.
Yeah, true.
So there was this time he had severe pain.
He
couldn't sleep for like days. That was when
he went to see a dentist.
Why do people usually wait until it's severe pain before they go to see the dentist? What must it be to that extent?
Okay, so I feel like in not just Nigeria alone, in Africa in general, we have a poor knowledge of health and poor knowledge, poor health seeking knowledge.
Okay.
Basically, and for that reason, most people would not seek health practitioners one way or the other until when they have serious issues. And one thing, and that's why we doctors usually recommend that just go to a doctor or go to the hospital, go for a checkup here and there. For this person you're talking about, this person had bad breath, and it's likely that the bad breath he has was as a result of a tooth decay. So there's one thing that most people don't know, and which is our mouth, our oral health, basically has a lot of bacteria. We have millions of bacteria in your mouth, so you can use all the mouthwashes, all the toothpaste in this whole life. Bacteria, they are still there, but the main thing is that are you giving these bacteria something to feed on? And what are they feeding on? They're feeding on sugar. So we have certain bacteria that their only function in the mouth is to cause bad breath. We have some that the only function in the mouth is to cause cavity, that's holes in your teeth, to decay. We have some that the only function in the mouth is to cause gum disease. They go in between the gum and they start breaking those structures here and there. So in that particular situation, so imagine now you now have a tooth decay, you have an hole in your teeth. It means that there's a space, and you know when there's a space somewhere, things will always want to get into that particular space. So it means that bacteria that cause bad breath would colonize, will create stents. They will have solar panel, they will get generator, they will get everything, every single thing. And they start doing what? They start grooming, they start giving birth, they have generations upon generations. But because you yourself might not even know you have bad, because usually most people is not when they tell them that they have bad, but that's when they know that they actually have bad breath. True. So for that person, the cavity kept on going deeper and deeper and deeper until when he actually had pain. That is when he asked me that, I need to see a doctor. And that is when they now go to, and funny enough, most people don't even go to a dentist immediately. What they do is that they go to a pharmacist.
Yes, yeah.
And it's not the pharmacist's fault. It's the fault of we, the people, actually. So they go to the pharmacy and immediately say, please just give me something for my teeth. And usually pharmacists, because they want to take care of you and stuff like that. So they'll just try to, okay, do you know what, use this, use that, use that. But what I usually tell people is that when you have anything that has to do with your dental health, the first place or the first person to call is a dentist or go to a dental clinic. That's the first thing. Don't go anywhere. Don't go to any chemist or any pharmacist whatsoever. Because at the end of the day, medications don't cure bad breath. Medications don't cure toothache or tooth decay or whatsoever. Medications don't also cure gum diseases. What cures it is a dental procedure. So if you've not gotten that dental procedure, at the end of the day, you are still going to have that thing. So you can probably use a drug. There's this drug they usually sell in the markets. They call it touch and go. Some people would have heard of it.
Touch and go.
Yeah, like it's like a table idea or something. They just put it there. They say you just touch it and it will go. And and also like there's another one again that some local people usually do that. They say they'll put a chemical in your teeth, and next thing you start seeing worms. They are not deceiving you. There's nothing like worms actually. What actually happens is that chemical that they're putting in your mouth, they basically pour the chemical. That chemical is very harmful to your gum and all those things. So basically, what they do is that they burn your gum. So by the time they burn your gum, you not see your gum. You not think that your gum is what? Is the worms? It's not the worm. There's nothing like worm in your teeth. What we have is bacteria. Those bacteria you can't even see them. So when you have any dental issue, see a dentist. Touch and go will not work. It will even make it worse. Medications will probably just give you slight relief, but by the time it's coming back in full force. And also, don't abuse medications. Very, very important.
That's amazing, Dr. Farouk. In Nigeria, Dr. Farouk,
Yeah.
chewing stick,
Okay.
painkiller, and herbal remedies, just like that touch and go you stated, are very common.
Very, very, yeah.
What do stats say? Do any of these actually help, or do they often make things worse?
Okay, so I would start with chewing stick.
Okay.
Before now, we had the whole like what was basically common in the old world was chewing stick, and that's because we needed to take care of our teeth. And even then, World Health Organization actually recommended chewing stick. Okay. But later on, as we've seen, actually, that the fact that things are actually getting better and people's knowledge are actually getting wider. Okay. That is when toothpaste came into the equation. Toothpaste and toothbrushes. Okay. So at the moment, if you have to compare a chewing stick and a toothpaste and a toothbrush, what you should go for is what? The toothpaste and a toothbrush. And the reason is that the chewing stick, basically, all it does is just mechanical action. It doesn't basically reduce bacterial action in your mouth or stop cavities or anything. What it does is mechanical. And like what I mean by mechanical is like you're using broom to sweep something. Yeah. Remember, if you chewing, so you're just chewing it, you just everything is catching and all these things. That's basically what it does. So now, if you have toothpaste and toothbrush, go for that. Please don't use chewing stick. Then down to herbal remedies. Don't ever use herbal remedies. As doctors, we don't even recommend that you should use herbal remedies. Some people say, if you use this, it will stop. They are just deceiving you. Because the truth about it is, those herbal people you're talking about, they still come to us. That's what most people don't know. They will still come to us because, okay, go and use it. Funny enough, we dentists or we doctors, we're not looking at you and say, okay, no problem. And one thing most people don't know is that these herbal remedies, what they call it, they are like they can be very, very harmful to your health and like your health and also your oral health, in the sense that the herbal remedies can lead to you having stains. Dental stains. I had a patient one time and he told me that, doctor, there's one time I was having issues with my teeth, this and this. I was now using one herbal concussion here and there. Next thing I noticed that the color of my teeth started changing. Yes, it would, because why? Those herbal remedies, basically, like, what they do is that like the process of herbal remedies, like bringing out plants. Those plants, they just put them together. There is no what they call like gradation, whereby you're trying to calculate that this particular amount of this we want to use here. So everything is all joined together, because even the drugs we use, I also got it from plants. But the reason why they're actually different from herbal remedies is the fact that the drugs we use are actually graded. You know that you're using this concentration, this and this. That's why we advise that you don't use herbal remedies. And one thing that herbal remedies also does is that there's one thing we call cleft slip and cleft palate. That's like a deeper part, whereby a pregnant woman was probably using an herbal concussion one way or the other. It's likely that the child that's going to come would have cleft clip palate. Probably you can just go online, search for it. Cleft clip palate is like something that has to do with like the oral health, and the sense that whereby you don't notice that there's a space in between the upper lip and the nose and all those things. So it's something that can be very, very deep. So we usually advise that you should not use herbal concussions or anything herbal whatsoever. So when it comes to pain relief is only for pain relief. It's only for pain relief, and it's just to relieve you for that pain for that period. It means that the pain is still there. So you need to treat the main cause. It's not like you're having headache that you just use paracetamol or one medication or the other. You're having toothache, you can use all those pain relief. Okay. But the thing about it is that's that toothache will still come. And one thing people don't know is that when you're having toothache, the time that you would actually have that toothache that will be more is always at night. Because why? At night, bacteria actually have more work to do. They are very much active, and that's because during the day we have saliva in our mouth. And one thing that saliva does is that it helps to flush. It helps to clean our mouth here and there. But when you're sleeping, you're dormant. Saliva production is reduced. At that point, those bacteria will start. Guys, how far where you do? Yeah, come out. Let us do one or two things here and there. Because why? They have a limited time. And now you notice that most people that have toothache at night, that toothache is always serious, whereby they cannot bear it. And one question that we dentists even ask is, you're having pain. Does this pain disturb your sleep? when we have to and you say yes, it's stop your sleep, we already know that toothache you're having has gotten to a particular level. We will not tell you what to do, but we still want to assess you and stuff like
Yeah.
that. So yeah, that's it. So it's not advisable for you to use chewing stick
Stick.
anymore. Use a toothbrush and a toothpaste. Then also, please don't use about medications. If you have any dental issues, see a dentist.
Dentist straight up.
Then if you have also pain relief, don't abuse pain relief. It's not good. Don't abuse it. When you need to use it and go to a doctor. That's it.
Thank you very much, Dr. Farouk. I was thinking about reading the stats myself.
Okay.
But like Stephen Bylet, which is my role model, I want you to paint the picture with data. So, how many people globally are silently battling oral diseases right now?
Okay, so when you say global, it means that the whole world. So
Yeah.
let me start with Africa.
Okay.
So in Africa, I won't give you a large number, but what I will tell you is out of every 10 people, at least 3 have dental issues.
Oh.
At least
At
3.
least 3
At least
people.
3. So imagine out of every 10, at least 3 people have dental issues. Dental issues can be in different forms. And aside from out of every 3 have dental issues, there's a particular issue which is more of like a gum disease.
Okay.
Out of every 10 people that you see in Africa, at least 7 people have gum disease. And it's the truth. That's just the truth.
That's just the
That's
truth.
what it's true, because it's very possible that so many people watching this video now, they are bleeding gum. And that's a gum disease. That's an early sign of gum disease. It's more of like the first phase before it gets to other phases. Then globally, Europe, every other place, I would say, well, because why? They have a better knowledge of health as compared to we in Nigeria, and their health-seeking behaviors are much more better.
That's true.
So I would say out of every 10, I would say probably 2 or 3 thereabouts. So it's not so much there, but then they actually have a lot of issues. I watch a lot of YouTube videos of people trying to seek dental care, and because they could not book appointment, let me use UK as an example. They could not book appointments to see a dentist. Though they're in pain and they're like, oh, okay, I'm booking an appointment for like 7 months and they're in serious pain. You see these people getting pliers and they're trying to take out their teeth themselves. At the end of the day, they end up breaking just the crown of the teeth, because obviously you cannot take out your teeth yourself. It's not possible. Except that is already shaking, really shaking, then it now comes out on its own. What they do is probably just break the crown and they feel like, oh, they're good, oh, they're fine. At the end of the day, you still come back, you still have that same issue you're having. So it's actually a lot, actually. And I won't just say just Africa alone that is going through that particular issue. Everywhere globally, we're actually going through it, actually. And that's why dentists are even fewer. Dentists are very, very few. Very, very few.
Why are they few?
Because the profession is not something that is so easy for everybody to enter, and it's not something that is cheap to enter. Even in Nigeria, you spend money to become a dentist as compared to going outside the country. It's not so easy, and that's why you hardly hear today that one dentist left the country, is now practicing as a dentist in the UK or in the US. You hardly hear it as compared to medical doctor. We say, I know one doctor now. He's not a doctor in the clinic. Because why? To travel out of the country as a dentist, it's not being so. But at the end of the day, when you travel out and you get those things and everything, you actually become better. But the thing is, the number of patients you need to see, there are a lot. Because why? Fewer people are in that space. And that's why we need more people to actually get into it. Not quacks. We need more people to get into it. Yeah.
So which age group are most affected about this dental issues? Which age group are mostly affected?
In terms of mostly affected, I would say the middle age. I would say I think people between the ages of 20 and above, between 20 and 40, they are much more affected. But then I won't say they are much more affected. Why? Is because these people actually get to seek dental care faster as compared to people above the age of 40. They're in their 50s, their 60s. They're like, law, it will go. This one, that's for Nigeria in particular. They're like, oh, don't worry, it will go. I've had it before. Blah, blah, blah. As compared to people in their 20s, they're like, what's going on here? And they've seen something on social media. Like, I think I need to see a doctor. I need to do this. I need to do that. So I feel like people are in that area actually. So generally, everybody actually has dental issues, even children. Most people don't know that children actually have dental issues. Sometimes we need to take out some children because of why? They have tooth decay, they have tooth pain, they have gum disease. Yes, children also have it. And I say children from the ages of even 3, 4, 5, 6, because at that point they already have teeth already. So they actually have dental issues. And that's why we advise that as soon as you've given birth, don't wait until when your child, or before your child becomes 1-year-old see a dentist.
Okay.
The reason why you're seeing a dentist is not that okay, there's something going on. You're seeing a dentist because you want the dentist to assess your child's state and to educate you on how
That's
to
true.
take care of your child's state. That's basically the reason why you're doing that. And also to ensure that like this your child is actually getting familiar with the dentist. Imagine a child that's from 1-year-old has gone to see a dentist. When he's to go see a dentist, he's to go see a dentist. That kind of child cannot have dental issues because the knowledge of dental health is already there. As compared to people that they've never seen a dentist before, they've never even got to clean their teeth before, they're going to have dental issues. It's not, there's no rocket science with it actually. So that's just it.
That's amazing. Thank you very much. When teeth hurts, the first thought is extraction. I want to remove this teeth. The pain is too much. Is that always necessary? Like if my teeth hurts, like I'm having a toothache like this, must I remove it before the pains go?
All right. So I'll start by saying I'm giving a story, and the story is about someone that sent me a message, and the person was like, "Doctor, I noticed that anytime someone removes their teeth, they end up removing another teeth, and they keep on removing other teeth. So for that reason, I don't want to see a dentist to remove my teeth. I just smile and I say, okay, that's just a myth that is very, very false, actually. So let's now go back to your question.
Okay.
And the question is, when your teeth hurts, you're having toothache, should you remove your teeth? Well, I won't say you should remove your teeth. One thing that we dentists firstly do is that we try to save the tooth. Because our main purpose is to save lives. So as much as we are saving a life, we need to save that tooth. So saving the tooth is the first option. But there are some cases that teeth cannot be saved. So let's say you have an hole in your teeth, and that hole has gotten so big that the crown. So the crown is that part of your teeth that is is round one way or the other. Like that's the crown. So imagine that crown has broken off. Like it's broken. Probably one part of it is broken off. At that point, you need to take out that teeth. But if you just have the hole is just there, though you're having toothache, you don't need to remove your teeth. There's what we call a root canal therapy. So the purpose of a root canal therapy is to help save that tooth. So it's an advanced procedure, but what we do in root canals is that we try to take out the infected tissue. So remember when I was talking about the layers of the teeth?
Yeah, you said
enamel, dentin, and a pop. Pop is the living tissue where we have the blood supply. So when you have a toothache, a tooth decay, that tooth is already infected, and the infection goes down to the pulp. So what we do in root canal therapy is that we take out the pulp. That is, we take out that living tissue out of the teeth. So it's not something that is straightforward. Something that there are times that you might go to a dentist, they start the procedure today, you go and you come back again some other time. Sometimes it can be a day visit here and there. That's that. So the purpose of root canal therapy. So in that case, we are saving that tooth. So if you have a toothache that is disturbing you, giving you serious issues, it's likely that you are within the range of either doing a root canal therapy or extracting the teeth. But the reason why most people go for extracting their teeth is because extracting a teeth is way cheaper as compared to doing a root canal therapy that is advanced. So canal therapy is advanced because it's blind. So it's way cheaper than what they call it, doing a root canal therapy. But what people don't know is that what people don't know is that when you take out your teeth, you're even going to spend more money than even saving it. Let me break it down.
Okay.
So let's say you've taken out your teeth. Next thing, when you take out that teeth, what happens is that there's a space there. That space there, people will like, that space is just there, but I'm okay, I'm fine. Yes, you're fine. But the thing is that space over time will close up. I'm very sure you're watching this video and you've taken out your teeth before, probably 5 years ago. Run your tongue around that area. You know that space
I'm running my tongue right now.
that space has done what? Has reduced over time. And what also happens is that, so let's say you take out a teeth on the lower part. I'm trying to use my hand to demonstrate. When you take out your teeth on the lower parts, remember there's a tooth on the upper part that usually bites on that teeth.
Yeah.
So what will happen is that teeth does not have anything it's biting on again. What happens is that teeth will now start pushing downwards. So if you want your tongue around that upper teeth, and you check it, you notice that it's not on the same level of the other teeth again. Because why? It's pushing downwards. I'm sure you're noticing it. That's that. Then also, so when you're done taking out your teeth, we advise you do what? You replace that. So every dentist will always tell you when you're done taking out the teeth, ensure you replace. But most people don't even think about it saying, I'm okay, I don't need to replace it. You do need to replace it. And there are several replacement options. The best replacement option is an implant. An implant is a lot of money. It's probably spending like $1 million plus thereabout to fix an implant. But imagine you do a root canal therapy. Let's say root canal therapy, you go to a clinic and it's probably like 200K or 100K thereabouts. When you're done with that, you need to crown that. Crowning is probably like another maybe 200K, 100K, depending on the clinic you actually go to
Yeah.
and stuff. In that case, you feel like, oh yes, in that case you've actually done what you've actually saved costs as opposed to fixing an implant. Though there are other options for replacement. We have the bridge and we have the denture. Denture is one that you remember, I'm sure you'd have seen videos of people taking out their teeth, removing it. That's called a denture.
Yeah,
You can fix it, you can remove it, but that one is temporary. It's not something that you're supposed to use for permanently. But most people actually use it for years because it's way cheaper.
Of course,
Let me just use this one, I beg. Which is something that can actually also do the work of what's retaining that space. Because the main purpose of replacing that is to retain the space. Remember when we were much younger, and you know these old people, probably people in their 100, 80s here and there. You notice that these people actually they've lost a lot of teeth.
And they still
there, but you notice that they cannot talk well, and you notice that all their cheek, everything is all sunk in, right? The reason why their cheek and everything is sunk in is because they've lost a lot of teeth. So basically, what this teeth that you have here does is that it also give you a better facial profile. But if those teeth are missing, or like what happens is that all this will drop because the bone here is going to reduce, it's going to shrink, and it reduces, and at that point, you already know what to do. So that's it. So we usually advise that. First thing, see a dentist, and the dentist will advise you on the best option. But when the teeth is already broken off, and then at that point, you just need to just take it out. But then we don't do root canal therapies on the wisdom teeth. That's the last molars. We don't do wisdom teeth there because the access to that point is very low, so we might not really see it there and everything. So we usually advise to just take it out because the wisdom teeth are not functional in your mouth. They're just there. Not everybody has wisdom teeth. I don't have a wisdom teeth. My teeth is probably, I think my teeth is 28. Some people have 32. Some people have 29. Some people have 31.
Well,
depending on your own structure.
Why is it called wisdom teeth? I was about to ask a question.
Oh, okay.
Does it link to our brain? No, the word wisdom.
Okay, so I feel like the word wisdom it's somebody that actually brought it out and just said wisdom. So I think maybe me too. I'll also bring out something and say, there's something with your teeth. I know the same. Okay. So wisdom. So I feel the reason why they use wisdom teeth is because it doesn't come out on time. Yeah, like it doesn't come out like it's more of like the last two to actually come out usually. Okay. It's more of the last that actually comes out, and then there are times that it doesn't even come out when it's supposed to come out. It just comes out whenever it feels like, and it gives people issues. And people are like, oh, I think it's the wisdom tooth. It's one that gives us wisdom. It's not connected to your brain or anything. It's not connected to the brain. It's just there. The fact that somebody has a wisdom teeth or does not have a wisdom teeth doesn't mean that the person doesn't have a wisdom. Okay. So that's that. So you might actually have wisdom teeth and actually be lacking. I'm just saying. I'm not saying you do, but then
you might.
So that's just so it's not linked to the brain or anything. It's just there. It's just called the wisdom tooth. You have a wisdom tooth. Most people don't have. We usually say, well, our teeth are 32, but usually it's not like 32 is the actual number. Okay. But then in some variations, it's not necessary for you to have 32 because that wisdom teeth is not functional. The other 28 teeth are the functional ones. What we use to eat, to talk, and do other things.
That's amazing. Thank you very much. We normally see TikTok trend, all those whitening powder, different kind of stuff. What risk do people face when they follow up this viral solution?
This is something that is really deep and is actually a big thing because we have a lot of people abusing a lot of things. Okay. And I won't blame them one way because we have a poor oral health knowledge. Even we as dentists, when we were in school, we were taught about teeth whitening. Yeah. I think I was taught teeth whitening in my final year. I was not even taught about that in my 500 level. Wow. That was my 600 level. So imagine them teaching me at that point. They're like, oh, okay. And at the end of the day, we actually were able to, okay, this is what it's about and stuff. But then what people don't know is that all those whitening powders you get. I was on a radio station one day and somebody called and said he uses one 5D whitening powder, this and this.
5D?
Yeah, 5D. And funny enough, we asked him to send a picture. He sent a picture. We even saw a typo in the label. I was like, okay, this one is most likely Nigerian made. It's usually Nigerian most of the time. But then these whitening powders, what they do, or what these things all these whitening products and all, is that they basically wear off the surface of your teeth. The surface of your teeth, as I said earlier, is the enamel, that white spot. Yeah. So it's like you're using sandpaper. So imagine sandpaper. And you're trying to use sandpaper to like scrub your iron. Probably your iron is stained. You want to scrub somewhere. What happens? You're basically scrubbing that surface. So imagine you're scrubbing sandpaper on your skin. What happens? You're peeling off the skin. Yeah. So when you do that, when you use that whitening powder on your teeth, some of you even use there's something about charcoal. There's one thing charcoal.
Yeah, charcoal. Yes.
Yeah, they will use it. They will brush. Kiniko. Don't worry, it's kiniko. It will work. Yes, it's possible that your teeth becomes white. Because why? You basically weared off that white part of your teeth, like the enamel, the first
the
layer.
first layer.
And when you're there, it will be appearing bright. But what thing you don't know is that you're basically exposing the second layer of the teeth. Because that second layer, which is the dentin, has like some holes that are connected to the enamel. So when you start scraping your enamel, what you do is that you expose those holes. Next thing, you start having sensitivity, and next thing, you are likely to have what? You are likely to have what? Tooth decay, that's holes in your teeth. So we usually advise that, don't go for all those things. If you need to whiten your teeth, see a dentist, speak to a dentist, they will direct you. And there's a lot of things on TikTok. I see a lot of them. Even spas are now doing teeth whitening.
Yeah, of course.
Is anybody that you say that is a spa doing teeth whitening is quackery. It's quackery. Just that, yeah, it is quackery, and it's just that in Nigeria we have this, like, I don't know, but one way, I think like you need to put a lot of work in Nigeria, honestly, because then this quackery is a lot. Funny how this spas even gets whitening patients than we dentists. And the thing is that we dentists would generally not tell you, come for whitening, come for this, because it's a cosmetic procedure. It's not a procedure that benefits your health. What it does is just cosmetic, just to make your teeth white. That's all. So you hardly see dentists always talking about whitening. No. But all those parts, you see them saying, we are doing promo, come for this. And you see them doing all sorts. I see a lot of things, and I'm like, and people actually, imagine you going to a spa, you open your mouth for them to, and I'm like, me, I'm a doctor. I spent how many years in school? You prefer to go there, but what happens is that most people that actually have, later when they go there, they have issues with their teeth. They now come back to be dentists. They now come and they say, this is what I have. And I'm like, no, it's not. It's not nice, actually. So we usually advise that if you need to whiten your teeth, see a dentist. And the thing is that not all teeth can even be whitened.
Not all teeth.
There are some teeth that are really stained, probably due to one herbal concussion, or probably like it was like when they gave birth to you, it was already there. It's more of like an intrinsic stain. We have two types of stains. We have the intrinsic and the extrinsic. So that's why I say see a dentist.
What does that mean? Intrinsic?
So basically, intrinsic means inside. Okay. Something that is inside the teeth. Extrinsic is outside. Something that is outside the teeth. Okay. So outside the teeth means that, like, outside stains means things like coffee stains, smoking stains, all those things. That's an extrinsic stain. It can be cleaned off and your teeth can be whitened. Okay. But intrinsic stains are stains that are already inside your teeth. So even if you whiten, you try to do all those things, your teeth cannot still be white. And funny how all these spas will still go there. You notice that these spas actually still white. Like when I talk about it, I'm usually very, very, very angry. Actually, because you see them, they will still whiten. I see somebody with cycling stain, and you're whitening the person, and I'm like, what are you trying to achieve? What exactly? And that's why we advise that see a dentist. So dentists can explain to you. Because I get people that say, don't want to whiten my teeth. I say, no problem, come to the clinic. When they come to the clinic and I evaluate, I'm like, I'm very sorry, your teeth cannot be whitened. Because why? This is kind of stain you have. Then I advise them of options they can do. Like veneers.
Okay.
That's what they will need to do.
Okay.
Do you understand? Okay. And there are times that some people go to a spa and all they do is just whiten your teeth. Some of them don't even clean your teeth. And the cleaning they even say they do, which is cleaning and polishing, the cleaning they even say they do, they don't clean. There's one video I watched one time and I saw them cleaning somebody's teeth. This guy was in serious pain. Jesus. They're just doing, and one thing, they don't actually clean your teeth. They just scrape the surface and they say they clean your teeth. But imagine me as a dentist, cleaning the teeth, that's cleaning and polishing that you all see, was an exam for me, a clinical exam.
Okay.
I had to clean a patient's teeth to pass that exam. If there was any slight thing, they had failed the exam. I will come back for that exam again. So imagine me doing that as an exam. But you just go on YouTube, you say you want to learn, then you now start doing it, you start performing quackery. That's totally bad. But one thing that most people do is that, like, I notice that when patients come, they say, no, doctor, I've cleaned my teeth. I say, where do you clean your teeth? One spa. I already know that they did not clean your teeth. I check your teeth and I'm like, I'm seeing that your oral health is very, very poor. Then why exactly are you going there? But the thing about it is that these people actually spend a lot of money in those spas.
Yeah, of course.
And to be very honest, when I see the aesthetics of some of all these spas, I'm like, they spend a lot of money in their buildings and all those things. They spend a lot of money. But what they are doing there is quackery. There's no certificate that will tell you that I'm certified to do this, but there's nothing like that. I was almost paid. I went to one spa one time and they were offering to pay me probably $1 million plus to train them there how to do this right. I said, I'm very sorry that I can't be training you to be doing quackery. You can go and learn whatever thing you want to learn somewhere else. I'm not. How much is your money? Okay, I can decide to collect the money and just code it. I could just do my day. But I was not interested.
That's true.
Because at the end of the day, I'm not adding value. What I'm basically just doing is causing more harm. to people that will see those people. And what people don't know is that when you start doing those things, go to spa, you do this, do that, and next thing you start having toothache, you start having cavities in your teeth, it can lead to an emergency and can be life-threatening. People actually think it's a joke until when you see or you heard someone that actually lost his or her life due to a tooth decay. That's when your eyes will be clear that I think I need to take these things very serious. So please, if you need to seek a whitening thing whatsoever, see a dentist.
You highlighted that oral health is a general health.
Yeah.
You know, data links mouth infections to heart diseases, diabetes, pregnancy issue. How strong is that link?
Okay, so most people don't know that this your teeth you're looking at is linked to your general health, but most people don't know this. So let me use gum disease as an example.
Okay.
Gum disease is like, your gums now, having bleeding gum and all those things. So as I said earlier, that you have some bacteria that all they do within your oral cavity is to go in between your teeth and your gum, and they break structures and they start creating space whereby next you see that your teeth are shaking.
Yeah.
So if someone has a gum disease, that gum disease can actually, that bacteria that is breaking those structures, going deep, can actually get into the bloodstream. And when it gets into the bloodstream, remember that the heart is what? The heart is the general house, is the pumping machine.
The powerhouse.
So every blood in your body goes through the heart. So imagine the bacteria from your mouth, from your gums and all those, just bad bacteria from your mouth goes into your bloodstream and goes into your heart. It basically does what? Cause a form of heart disease, and it can be different forms of heart diseases actually. So that's why we advise that see your dentist for just go for checkup and just clean your teeth and you're good. Actually, that's for gum disease. When it comes to diabetes is also linked to gum disease also. It says that when somebody has diabetes, it's likely that the person also has a severe form of gum disease, which is called periodontitis. When somebody has diabetes, it's likely that your teeth are shaking. And when your teeth are shaking, then you have periodontitis. But one thing that most people actually miss out is that when you are treating, let's say you have someone or you know someone that is treating diabetes, it's very important for you to also be seeing a dentist. And the reason for that is you are seeing your doctor for the diabetes, you are getting your medication, you are using it. But one thing I want to put to you today is that it doesn't end there. Because why? When you are treating only diabetes alone, and you don't treat that gum issue, it will basically make that diabetes get worse. You notice that you're using medications and you're still going back to the same thing. You say you get better, you go back to the same thing. So the two of them need to be treated. So it's like you're treating diabetes, you also have to treat what? The gum disease. Or if you feel like, oh yes, you have diabetes and you don't have gum disease, see a dentist, let him confirm that, oh yes, you don't have that gum disease. So that's why I remember when I was training and we had patients that come in from, I train in Lagos University Teaching Hospital, that's Lutz.
Yeah.
We had patients that come in that have diabetes and everything. And like we just do a check on them. Usually, most of them usually have shaking teeth, their teeth are always shaking, and that's why we advise that if you have DM whatsoever, that's diabetes, see a dentist. And sometimes too, there are times that even we dentists actually find that, oh, this person has diabetes. When I examine you and I'm seeing one teeth is shaking, 2, 3, 4 teeth are shaking, I'll tell you to go and do a blood sugar test. But it's likely you have diabetes. It's very likely because they are both linked together. So when you are treating them, you need to treat the two of them. You need to treat the two of them. So one cannot work in isolation. So they are all linked actually, and that's basically the way it goes. But when it comes to tooth decay, the link between tooth decay and diabetes and other health conditions has to do with your immune system. So let's say you have tooth decay and you have diabetes. Diabetes basically brings your immune system down. Person's immune system will be very down, and you now have tooth decay. What will happen is that tooth decay is an infection. It's a dental infection. Yes. It will basically, because your immune system is down and your body cannot fight those things, the infection will spread faster. And when it spreads faster, that tooth decay can lead to a swelling. And that swelling can lead to something that we call Lodwig's angina. Lodwig's angina is what they call it, an emergency, it's a life-threatening condition actually. It's a life-threatening condition. So if someone has gotten to that point, you should just see that the swelling is decreasing and it has gotten to your neck. At that point, just rush the person to the hospital. Not just a dental clinic, a private dental clinic, a general hospital. But that's where the person can actually get the best care. Because if the person is not taken care of immediately, in few hours, that person can lose his or her life. Because why? The person will not be able to breathe. And most people don't know that. And that's because the person already has a low immune system. The same thing happens with hypertension. hypertension and other heart diseases and all those things. So there are other things that are also linked. So that's basically the major ones. So there are major ones because there are times that we have people with infections like HIV and some other infections like that, actually hepatitis and all those things. They have oral features.
Oh.
Like there are certain ulcers that will see you, man. I'm like, oh, you have this particular condition. And then things I'll see you, man. I'm like, oh, you have this condition. Oh, it's likely you have this. Go for these tests. So, but most people don't. But like most people feel like then it's only the teeth. It's not the teeth. I can see something in your tongue, and I'm like, oh, you have this condition. I want you to go and check this. Go and check that. There are times that most conditions are even found from the dentist. Then they'll see that this thing, pay attention. There's something going on.
Wow.
But most people don't know. They feel like, oh, then it's just the teeth. That's going to move your teeth. That's so I know it's deeper than it's way deeper than that deeper. Actually. Even though we don't talk about every single thing, we just try to talk about the major ones, and that's what I usually talk about most times. And the foundation of everything is what? Brush your teeth twice.
Brush your teeth twice daily. I always say that. That's amazing. That's amazing. Brushing and flossing done wrong can cause more harm.
Yeah.
What common mistake do people make? Like that thing, people don't even consider that is a mistake that they make when they are brushing. When there is this toothpick, I used to call it floss pick, you understand? What are the common mistakes people make without them knowing that it's a mistake, and what harm can it cause?
Okay, so when it comes to flossing and your toothbrush, as brushing your teeth, I'll start with toothpicks. Let me start with toothpicks. First things first, don't use toothpicks. If you're using toothpicks, stop using toothpicks. It's not good for your oral health. What toothpicks does is that it creates spaces in between your teeth, whereby allowing room for bacteria to do what? To dwell there more. So nobody's supposed to use toothpicks anymore. Because when we are using toothpicks straight away, if you go to a restaurant and you see toothpicks on the table, tell them, please, you will stop giving us toothpicks. Give us a dental floss. Because if something gets stuck in between your teeth, what you're supposed to use is a dental floss.
Okay.
Dental floss is something in form of a thread-like thingy. You're just running in between your teeth. There are some that you see like a plastic and it has like a thread. Put it in between your teeth and you're good. If something gets stuck in between your teeth, that's what you should use. But then in the morning and night, at least every day, ensure you floss your teeth once a day. Ensure once a day. And the reason for that is that our toothbrushes cannot go in between our teeth. It can only clean up the surfaces and all those ones. It cannot go in between the teeth. So the purpose of the dental floss is to go in between our teeth and take out those plaque. So because some people ask, okay, when we brush out, what are we even taking out? What you take out is plaque. Plaque is basically bacteria, food particles, food debris, and saliva and some other things. They all form together. That's what we take out when we brush our teeth. But there are some other ones that you notice that around your teeth, they are be hard. Those ones are called calculus. Is that plaque has become hard, and at that point in time, your toothbrush cannot take it out. So you need to see a dentist so they can do what? They can clean your teeth. So ensure you do what? Ensure you floss in between your teeth. When you brush your teeth, what happens is that you can only take out 90% of the plaque. 10% stays there. And that 10% that stays there builds up over time. And next thing, you don't notice that there's no space in between your teeth. You try to, like, even when you're drinking water, before you're drinking water, you say that water goes in between your teeth. But now you notice that when you drink water, it just bounce back and everything. When you try to floss and try and floss and rinse out, you notice the difference. That's that. So floss at least once a day. Then also you need to, when you're brushing your teeth, you need to use a toothpaste that contains fluoride.
A toothpaste that contains fluoride.
There's a controversy when it comes to fluoride. People are like, fluoride is harmful, fluoride is this. But when the dentist tells you to use fluoride toothpaste, it's because we know the purpose of a fluoride toothpaste. We know what it does. As much as we know what it does, we know the harm in terms of fluoride when it's used in high proportions. Because as I said fluoride now, so who wants to come and say, doctor, you said fluoride. Don't you know that fluoride is here? And I'm like, people who say you don't research. As a dentist also know all these things. All these things are not new. But one thing you need to know is that the fluoride concentration in toothpaste is completely safe. It's completely safe. So if you're in Nigeria, especially in Nigeria, other African countries, that you know that your water system is not centralized. It's not the one that you just put on your tap, water comes out. Unlike Nigeria now, you build your house, you do what? You have your own borehole. You are the one producing your own water yourself.
Yeah.
Your water is not treated with fluoride. Then you should use a fluoride-containing toothpaste.
Okay.
I'm not saying you should go and treat your water with fluoride. I'm talking about people in generalized areas like other countries. In Nigeria, you should use a fluoride-containing toothpaste. That's that. Then also, when you're done brushing your teeth, ensure you don't rinse out immediately. what you do is spit out the excess toothpaste in your mouth and just allow your mouth stay for about 5 to 10 minutes.
Like when I'm done brushing,
When you're done brushing your teeth, exactly. Just spit out all those things in your
pour,
mouth.
pour.
Pour them out and just allow your mouth stay
Wait.
for about 5 to 10 minutes.
5 to 10 minutes.
About 5. You can do other things, but just allow your mouth just stay for the 5 to 10 minutes before you decide that, oh yes, you want to rinse your mouth. The reason for that is the fluoride in toothpaste usually takes about 5 minutes for it to work effectively. So, and what it does is that it helps to stop the action of bacteria in your mouth. That is, let's say they start drilling holes in your teeth.
Okay.
It stops that action. The hot teeth, they cannot drill it again. What it also does is that it reduces the activity in your mouth. It also helps to give you fresh breath, and also what they call it, like strengthens your enamel, that is your teeth.
Wow.
That's basically what you do, and that's why it's very important in your toothpaste. If you are using a toothpaste that doesn't contain fluoride, you're likely to have tooth decay. Are very likely to have tooth decay. I've seen patients that say, I don't use because of clinical, and I check their teeth. They have several teeth that have tooth decay. And the same thing applies with the gum disease too, because it's still that same fluoride that will help to do or stop the action of those bacteria.
That's
so
true.
You need to do that. So when you're done brushing, spit out the excess, allow your mouth to for about 5 to 10 minutes, and don't rinse your mouth. What mistakes a lot of people actually do is that when they are done brushing their mouth, they now use a mouthwash.
Again.
They now use a mouthwash. I remember that I'm like, for your mind, I think say you don't sabi. Come on, I just boo. I just boo yourself, because really, I'm very sure some people are watching this video and they're like, that's what I do. I'm just telling you that you'll be doing the wrong thing. The mouthwashes that you're actually using are usually supposed to be used probably during the day. And the purpose of mouthwashes, the reason why they're created is for people that actually probably they've not eaten and you are probably fasting, you just want to have that fresh breath, because when you've not eaten and you're fasting, you are very likely to have this bad breath, which is normal.
Yeah.
You understand? So that's the purpose of that, what they call it, mouthwash. Not that when you're done brushing, now use your mouth. No. The only thing that you probably even want to use your mouth is, okay, let's say the mouthwash contains fluoride, then you can use that. But if it doesn't contain fluoride, please don't. I'm not going to mention any name, any brand whatsoever. But then don't use mouthwash to rinse your mouth. What you're supposed to do is allow your mouth stay for 5 to 10 minutes. Then after that 5 to 10 minutes, you can do anything that you like. So that's it, actually. So that's the mistake that a lot of people actually do. And a lot of people don't even floss. I'm very sure some people are watching this.
I also make that mistake.
People actually watching this and they've never even heard of what a dental floss. They've never heard of dental floss before. They've not even seen it, or probably they've seen it, like, it's probably for fashion. And what people do is that you see them running. Don't let me say some other things. Let's just keep it like that.
Yeah, okay.
So please brush, and also brush your teeth twice daily. Not just brush in the morning and alone. Brush twice daily. Use a dental floss, and also clean your tongue. Very important, because there are food debris that usually accumulates around our tongue. So you need to always clean your tongue. You can either use your toothbrush, bristles, to clean your tongue, or you get a tongue scraper. All these things are in the market. Yeah, and also, a mistake that a lot of people do is they use hard toothbrushes. You are not supposed to use hard toothbrushes. Nobody. They say hard toothbrushes. They say it's for smokers. It's a lie.
What is the name of this brush? I'm trying to remember that brush. Maybe the brush name is Wisdom.
Wisdom. Wisdom. Yeah, it's an art. Anybody that uses it's very it's like iron sponge. Like iron sponge. You're not supposed to use hard toothbrushes.
Okay.
Hard toothbrushes. I'm very sure people will be like, okay, you're telling us to use hard toothbrushes. So why do they produce it? Why exactly?
Why?
I'll put this to you that the same way we all know that cigarette is bad for the health. Don't they produce it? The same thing with alcohol. It's bad for the health, but people, they still produce it.
Of course.
There's always a market for anything. Either it's bad or it's good.
Yeah.
So don't use hard toothbrush, because if you use an hard toothbrush, it's like you are grinding two stones together. And you know when you grind two stones together, what will happen? The surface of that stone will be flat. So in that case, your teeth is the stone. That hard toothbrush is the other stone. You are doing what? That toothbrush will spoil, but you know your teeth is inside of you. You like basically what you do is that you basically wear off that enamel little by little. Exactly. Next thing, you start having sensitivity and all. So you should not use that toothbrush. Use a medium toothbrush, and children should use soft texture toothbrush.
That's amazing. Thank you very much, doctor. Which food, especially those in Nigeria diets, help or harm the local, that harm the microbiome? Which food? Because some people tell you that if you eat beef, it will spoil your teeth. You know, a lot of people say a lot of things. There's a lot of what we like call it a lot of stories, false stories. Which type of food should we, that doesn't have any knowledge about this dental stuff, which food should we be eating, and which food should we stop eating? You know, these are the things I'm thinking about.
All right. First thing, I usually tell people that as much as you want to eat something, ensure you eat balanced diets. That's
Okay.
one. Ensure your food has a lot of fruits and has a lot of fiber. The reason why I said fiber,
Yeah.
basically what fiber basically does is that it helps to clean out things around your teeth, things that stick on your teeth and
Okay.
all. And you can get fibers from beef and some other proteins
Okay.
and even some
Okay.
for some fruits and other things. That's that. So I won't say there's this thing you should eat or there's that thing you should eat. But what I would say in essence is as much as you're eating, ensure you always brush twice daily. That's morning and night.
Go on.
Then also avoid late night snacking. People have this habit of snacking at night. You wake up around 2 a.m. You're going to your fridge, you're carrying plantain chips and you're chewing it. In your mind, you don't chop for night, too. You don't know, like you brush your teeth at night, too. But then you still wake up around 2 a.m. Some people even keep chin plantain chips under your pillow. Some people keep it close to them because they don't know that when they wake up, they don't want to be munching something. But one thing you don't know is that when you munch those things, bacteria will also munch on your teeth. It's very funny, but and that's the truth. And the reason why it's the truth is that at night, as I said earlier, that your body is dormant, saliva production is reduced,
Yes, you
so
said that.
bacteria can actually work more around your teeth. And basically, what happens is that when you're not eating those things are now on your teeth.
Yes.
You now go and sleep. It's like you actually go to a party, and that particular party you went for, you actually went with food to that party, and you decided that, oh, okay, this food, I'm not going to use it. I want to give it to people. That's basically what happened. So that party is the bacteria. You like they are there already in that night, and they just go there to do what? They just feast on the food you bought for them. They say, "How much out there? Oh, you guys have for show." They start calling themselves here and there. And next thing, they start eating on those things. And one thing, when this bacteria eats on your teeth, what they do is that they release a substance that breaks your teeth little by little. So if someone says, "I have toothache," or "I have my teeth, I have an hole in your teeth," that hole or that toothache you're having has been there for years. Not 1 year, not 2 years, not 2 months. So be like, it's just 2 months, started 2 months ago. And it has never happened before. You've had that hole in your teeth for years. Because it takes time for it to get to that pop that you not start having pain. So avoid late night snacking. Even if you want to take something that has to do with, let's say, a carbonated drink, soda that contains sugar, because I usually advise that, I want that you want to take it, reduce it, and all those things. Even if you want to take it, we usually advise that you take them during mealtime. And what I mean by taking them during mealtime is that when you're eating, let's say you want to eat rice now, you can take those things when you're eating rice. Because why? When we eat, we produce a lot of saliva in our mouths. In that point, saliva is a lot, and one way that's when you're taking those things, so there might be less work that those bacteria will be doing actually. Because as soon as you take anything sugary in your mouth becomes acidic for about 30 minutes. And that acidic nature of your mouth stays there for 30 minutes. But after 30 minutes, it goes down to what? To an alkaline state, whereby your mouth is no longer acidic, it's just normal and all those things. But imagine you take something sugary now, your mouth is acidic for 30 minutes. In like 20 minutes after, you take another one again. So you're basically making your mouth acidic for like 30 minutes. Then you're doing what you're expending it. So as much as you want to take those things, or probably due to your work, you know that sometimes you need to take sugar, all those things, because of energy and all. Have a bottle of water close to you. When you're done taking them, use your mouth. So you're not allowing them to even stay. Spit out. And that's so there's something there's an act that I usually tell people that and there's something you can also do. Have a straw. Use your straw. Drink it, because when you use your straw.
So wait, so there is this benefit of using a straw too.
Yeah, there is a benefit of using a straw when it comes to the oral health, and the benefit is that when you use a straw, you're basically drinking that thing directly into your throat. So in that case, what happens is that you're not allowing that soda or that thing you're drinking or food juice to stay on all the surfaces of your teeth. Unlike when you take it directly and it just stays there and then you drink it.
Okay.
Do you get? But not the one that you now take something, you suck it through the straw, you now start using it to rub on your teeth. It's still the same thing. Do you get? But provided you're just sucking it in, then that's it. Because the thing about it is sugar can even be gotten from fruits too. Even food juice also contains sugar, form of sugar one way or the other. So bacteria also feed on them. So as much as you want to take those things, reduce it. Then also for children, avoid them taking chocolate, or they want to chocolate, but don't let them take it at night. Because those things will stick on their teeth.
Midnight snacks.
But when it sticks on their teeth, like, they start having what? Cavities. The same thing, biscuits, all those things, sweets, all those things. You should not take them at night. They can take it because when they're children, they need energy and all those things. Yeah, they can take it, but they should also reduce it. And there's one thing we usually tell parents and caregivers is that you can form fruits in form of candies.
You can form fruit.
So let's say you probably get something like, I think I think they usually sell it in the market. You just take something that actually that you like what do you call like get your fruit juice, you pour it, then you put it in your what do you call like your freezer. It becomes hard and all those things. Then you give it to your child as a candy.
That's true.
So that replaces the chocolates, replaces all those other sugary things.
That's true.
Actually, so that's something that you can also do. So one thing that we need to do in terms of our diet is reduce sugar intake and brush your teeth twice daily. Don't snack. Late night snacking should not be done. Take it out. Skip it out. But you can eat any other thing. You can eat your meat. You can eat your fish. You can eat anything.
Anything.
But please don't break bone. No, don't break bone. Don't break bone. I'm very sure some of you are like, no, you must not mention it. I'll mention it. Because when you break bone, it's still the same concept. You are eating two stones together. And one thing that can happen is that as much as the teeth will be reducing, the layer of the teeth will be reducing, you can also break bone and the teeth just snaps.
That's true.
And when it snaps, it goes down like that. And when it goes down, you'll be in serious pain. And the only solution is to remove your teeth. So you don't want to break bone. So don't break bone again. Some people say, the bone, they taught us that this bone will get calcium from it. Oh yes, you would actually get calcium from bone. But do you know that you can get calcium from other sources of food? You can get calcium from milk and some other things. So what actually happens is that when you are breaking bone, you're actually causing more harm than good. So please don't break bone.
Don't break bone. Don't break bone. That's amazing. Many fear dentists due to trauma, you understand? How do you help patients overcome fear and trust modern pain-free treatment? Just like you mentioned that some people, they will go to the spa to get this tooth whitening because of that pain they pass through is a trauma. So I can't go to that dentist. Maybe it's the same thing, you understand? How can you help them to overcome this trauma?
Okay, so pain can be in different forms actually, and as dentists, we one way or the other try to educate our patients that for every dental procedure you do, you're not supposed to feel pain, and if it's a procedure that entails that you would feel pain, is what we give patients is a local anesthesia, like
what do you call it?
A local anesthesia, like an anesthetic, so just to do what? To numb that area, so you will not feel pain during that particular procedure. So let's say you want to take out your teeth. I remember when I was much younger, I went to do an eye test. I think I went to last week. So where we were sitting down was close to where they usually the dental section. I was just hearing people shouting, and I saw somebody holding them. I'm like, how are these people doing? I was probably in just 1 or just 2 about. I never knew that they'll still become a dentist. So I think people then were actually having pain and all those things. But then as dentists, like the word has actually evolved to the point that you should not be feeling pain during your procedure. It's just like even surgery. Let's say going into the theater and all those things. They basically put the patient to sleep.
Yeah, of course.
And we also numb that area. You need to work on. Then after that, you need to be on medications because of slight pain. So we just advise you that don't worry, you're not going to feel pain because we'll give you a local anesthesia. So in that process, you're not going to feel pain. That's why we advise that you see a dentist, because some people actually end up going to a quack and they do some other things for them. They don't do some tests and all those things. At the end of the day, they now fall victim of one issue or the other. So we give you local anesthesia so you don't feel pain. So you should not be afraid of seeing a dentist.
You shouldn't.
You should not be afraid. We are actually very wonderful people. We are actually very wonderful. And we don't want you to feel pain, because the main purpose of you seeing a dentist is for you not to be in pain. So we don't want you to feel pain. So I think that's basically what we do. But there was I remember one time like that, I had a patient when I was still a student. I needed to do an extraction for a patient. And I'd given this patient a local anesthesia. Well, this patient was still in pain. I'd not even started the extraction. I only do an extraction. The patient was still in pain. I said, okay, let me give the patient another one. I gave the another shot. The patient was still in pain. And I'm like, because there's one thing we do after giving local anesthesia. We test that area, that place I want to know. We test it subjectively and objectively. What I mean by subjectively, we ask some questions and we feel that you should give us response that will show that, the thing is working. Then we test it objectively by touching that area. We just tap it. When you tap it and we touch it, you say, okay, I'm not feeling pain there. I did all those things. All these things is perfect. And she was still in pain. My senior colleagues there, and they were like, what's going on? And you're not doing, they were basically thinking that I was not doing the right thing. I was like, I did the right thing. Leave here. He said, I put me to one side. I was not looking at them. They brought out another shot of local anesthesia. They gave the patient another one. They wanted to do the extraction. The patient was still in pain. At that point, we realized that, what she has is not just pain, it's anxiety. So when you have anxiety, you feel like you're having pain, you're actually not having pain. So anxiety can also come in place of pain. You're like, oh, I'm in pain. You're not actually having pain, it's just anxiety. It's just your brain sending something and saying, this thing is paining me, but it's not pain, it's anxiety you're having. So in some cases, some people actually have that. And what we just do, we just tell you to go and you come back. Do you understand? So by the time you actually go and come back, everything would have actually gone down. Your anxiety would have reduced. So the main thing is when you are in a dental office, be relaxed. If you need to ask questions, ask questions. Please hope this will not pain me. If it's going to pain me, what are the things I can do? Ensure you always ask your dentist questions. Don't just go open your mouth. Ask them any question you want. I'm very sure they are always there to answer you. So yeah, that's
amazing. That's amazing. Thank you very much. Dr. Farouk, for someone who hasn't seen a dentist in 5 to 10 years, what should they do first? And what basic test should they expect?
All right. So the first thing, you've not seen a dentist in 5 to 10 years. All you just need to do is go and see a dentist. Very simple. Just go and see a dentist. And dentist just does a check to be sure that you don't have any cavities, and they also clean your teeth. That's very important procedure to do. The cleaning is called scaling and polishing. What it does is it basically helps to remove plaque and calculus, those things that become hard in your teeth. Basically takes them out, and when it takes them out, it prevents you from having bad breaths. Prevents you from having tooth decay. Prevents you from having gum disease. So that's basically what you need to do. And then if you probably have some other dental issues, probably you have a cavity, they want to do other tests like doing an x-ray, then probably do a filling. It all depends on what you have. So if you've not seen a dentist before, or in 5 or 10 years, I'm very sure people, this is the first time they have even seen a dentist in a video. Actually, what you just need to do is walk up to any dental clinic and just see a dentist. Dentists are very easy to actually assess.
That's amazing. If you Dr. Farouk, if you have 30 seconds to speak to the young Nigerians, especially those who think oral health doesn't matter, what should you say to them?
All right, so you have 30 seconds. What I will say to you is, remember that when you eat, your food goes through where? Your mouth, right? So remember, put that at the back of your mind. So think about it that when you're putting something nice in your mouth, you need to do what? You need to ensure that mouth, you need to take care of that mouth. Because when you don't take care of that mouth, you will not be able to eat those nice things that are going into your system. So how can you take care of that mouth? Brush your teeth twice daily. Both in the morning and both at night. I usually say it, and I'll keep on saying it, and I will not stop saying it. Use a medium texture toothbrush if you're an adult. Children should use soft texture toothbrush. Use a toothpaste that contains fluoride if you're in Nigeria, or if you're in Nigeria. Use and also clean your tongue. Then don't forget, always floss in between your teeth. Floss in between your teeth, and don't wait until when you have a dental issue before you see a dentist. Always see your dentist at least every 6 months for a checkup and for a routine scaling and polishing, which is basically professional cleaning. If you do all this, you should not have any dental issues. You should not have any whatsoever. And if you have any dental complaints whatsoever, always see a dentist. So yeah.
That's amazing, Dr. Farouk. Thank you very much. This is this small souvenir. So I appreciate you coming to the studio. And I want you to read down this.
Thank you so much. All right, so let me read. Thank you. So it's really nice. It's been a while I actually got a gift. All right, thank you so much. This basically says there is no shortcut to achieving something that will stand the test of time. Moonword. So there's no shortcut. Please go
straight to the point. Always brush your teeth twice daily. You understand? And tell a friend to tell a friend. Moonword Podcast is here to stay for a very, very long time. And your mouth isn't where you speak. It's where your body speaks first. Oh, you can't be speaking. When you are noticing that you normally win every argument easily, you should notice something about yourself. There's this story. Let me tell you a short story. There's this guy, anytime we are arguing, and anytime he opens his mouth, bros, I don't hear you, don't, we let him win because of his bad breath, you understand? Don't beat that as well, you understand? Brush your teeth twice daily and tell a friend to tell a friend. Moonword Podcast is here to stay for a very, very long time. Until the next time.
Moonword talk. 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 Yeah, we be the truth. Be that light in the dark. Let the vibe come through. Growth mindset, mind check. Yeah, we break the mold. Had to hustle. feel some struggle, turn that pain into gold. Oh, so done, but the grind don't stop. Scraps and tapping, let's rise to the top.